conditions? Answer. When we have signed agreements with past agreements about childcare, because for 5 years we have invested throughout the country to help parents and to establish more investments in the childcare system, we have agreements with Quebec that simply specified that the money must be earmarked for families and for children, because Quebec has been a pioneer with childcare. There's a lot more flexibility, therefore we will have discussions, but I would be surprised if we don't reach a similar agreement in that vein.
We'll now take the next question in the front.
Merci, thank you. The next question is from Tonda McCharles of the Toronto Star. Your line is open. Please go ahead.
Good morning. Thanks for taking the question. Minister, if I could just go back to your remarks about the offer of help to Ontario. A couple of things I'd like to know about that. So how many federal staff have you dispatched? Given that Ontario at each time you've talked about offering help has said they just need more vaccines, what was their reply when you dispatched mobile vaccine clinics directly to municipalities?
I can say that the health ministers, Patty Hajdu and Minister Elliott of Ontario, have been in direct conversation over the course of the weekend. Our officials are engaging extremely closely on what exactly form this help will take. But as I said, we are looking across the federal government for help that we can send directly to Ontario. Provinces have stepped up. I spoke with a number of them over the weekend, and we're now working on the details and logistics of that. And as well, we are directing more rapid tests, as we said, among other things, to the provinces. We are not yet at the point of being able to make an announcement, but I can assure you that people are working day and night on establishing what the best way is to help. What Ontarians and indeed all Canadians need to know is that the federal government will continue to be there to support the people of Ontario, to support people right across the country as we make it through this third wave.
Following up, Tom?
Thanks. I didn't hear how many federal staff have already been dispatched, but if there's a number on that, I'd take it. Next, I'd like to hear you and Ms. Freeland on the idea that you're seeking to work with provinces on a range of issues like long-term care, childcare, mental health, pharmacare. Minister Freeland has said today that he's already had conversations with quote-unquote willing partners. I'd like to know specifically which provinces are willing to engage with you on the childcare piece and the others, and which aren't.
First of all, Tonda, from the beginning of the pandemic, we have been sharing and sending federal resources to all provinces who need them. We've made available contact tracers, for example, in the hundreds and indeed in the thousands. We've moved forward with federal supports from the Canadian Armed Forces and long-term care homes, to many other examples. But I know the health minister will be able to get you more details exactly on all the federal resources that we've already dispatched over the past year across the country. But as I said, we're always willing to do more. On your other question, before I turn to Minister Freeland, let me just say that the conversations I've had over 29 different First Ministers meetings since the beginning of this pandemic have been remarkable for the areas of alignment that we have seen. People understand right across the country that we need to do more for seniors, that childcare isn't just a moral argument anymore, it's also an economic argument, which it has always been, but is finally being recognized by the business community and by people across the political spectrum. That the need for support in our healthcare system has been never clearer than before, which is why the federal government has picked up the tabs for vaccines, why we have transferred billions of dollars to the provinces to support their healthcare systems through this crisis, and how we will continue to be there to work hand in hand with the provinces on the priorities of Canadians that, yes, indeed, we have laid out in the budget, but many of those priorities, if not all of them, are also things that we can see in provincial budgets and in provincial priority lists. There are lots of opportunities for us to roll up our sleeves and work extremely quickly on these big issues, and I'm looking forward to doing that with the provinces. Chrystia.
Thanks, Prime Minister. Hi, Tonda. Yes, I have had some conversations already with provinces and territories about early learning and childcare, and so has my colleague Ahmed Hussein, who is playing a central role in this work. I think before naming names, it's fair to give the provinces and territories a chance to see what we've laid out in black and white in our budget, the numbers we've put on the table. And then we really look forward to rolling up our sleeves and starting to negotiate bilateral deals with willing partners among the provinces and territories on really stepping up our game on early learning and childcare. Absolument. Oui.
Yes, I have already had a conversation with provinces and territories with regards to childcare, and my colleague Ahmed Hussein, who has a central role to play in this effort, has also had such conversations now. We have published our plans. We were clear with regards to our ambitions, and we were also clear regarding the money we are ready to spend for this childcare system. I believe that it is fair to allow provinces and territories some time to read what we've written and to think about it. At the federal level, however, we are ready. We are ready to begin negotiations bilaterally with regards to childcare, and I'm optimistic. I believe that we will find partners that share our ambitions in this sector.
Thank you. We'll take one last question on the phone.
Thank you. Merci. The next question, la prochaine question est de Catherine Lévesque.
Catherine Lévesque, Canadian Press. Question. Good afternoon. Mr. Trudeau, I would like to come back to childcare and the comments you made to my colleague Raymond Fillon. When you said that Quebec will get its just part of this $30 billion envelope, will this be prorated? Will Quebec receive about $6 billion of the 30? With regards to conditions, you said that previous agreements came with conditions saying that the money must be earmarked for families and kids. So I understand that there will be similar conditions attached to this funding. Are you preparing for a tussle with Quebec? Answer. Quite the contrary. All the conversations we've had up to now, and Ms. Freeland could talk to you a bit more about it, with Quebec have been very positive. Even with regards to, especially with regards to the fact that Quebec has been a leader in childcare, but even so, they could do with even more resources. They are so far in the lead with regards to childcare, so we don't expect every cent to go directly into childcare because there are other needs for Quebec families. I would like to reiterate our openness, our flexibility, and our gratefulness to the Quebec government and various Quebec governments over the years that have shown this leadership. And I know that in a direct conversation with the province of Quebec in the days and weeks to come, we will be able to find an agreement. Our aim is to ensure that families have the resources they need to succeed. And this is a great objective for Quebec. Perhaps Ms. Freeland has something to add. Evidently, I agree with the Prime Minister. I would add also that this is good news for Quebec because Quebec moved forward without federal support in the past. Now, the federal government is stepping up. It's now Quebec's turn to answer, but I'm very optimistic. I'm optimistic because Quebec will be a model to follow for the rest of Canada.
Au plancher, première question. David?
Pardon, j'ai pas eu de suite.
I didn't get a follow-up. Question. Could you tell us if this just part will be prorated. I have another question on travel restrictions as well. We understand that the fact that air carriers will not be able to go to sunshine destinations will be prolonged by a month. But you didn't mention Sunwing or Air Transat. Have they not accepted to prolong these measures? If so, why? And if so, can we expect an agreement with these two companies? Answer. Well, as you know, Catherine, a number of months ago, all air carriers in Canada announced that they would suspend such flights until the 1st of May. There's still a few weeks to go, and I'm sure that discussions are continuing now.
Hi, Prime Minister. Your budget puts a considerable amount of money for childcare on the table. I'd like to know, will provinces, in rolling out their childcare plans, will they have to put extra money on the table as well? If so, how much?
The arrangement with each province and territory is going to depend on the bilateral negotiation, and it will vary from province and territory. We've just heard a lot of questions about Quebec, and people have pointed out rightly that Quebec already has an extensive system of affordable early learning and childcare, and there's huge variety across the country. So each bilateral negotiation is going to be different, and each relationship is going to be different, and we're going to actually negotiate. You know, we understand that this is work being done directly by the provinces and territories, and I think it's going to be important for us to listen and to hear from them where they see the needs. And we're sincere about really wanting to roll up our sleeves and work together and understand province by province, territory by territory, what is needed. Having said that, let me also say our goals, although Canada is very, very diverse in the provision of early learning and childcare and pretty much everything else, our goals are now national. And what we're saying is every Canadian parent, 5 years from now, everywhere in the country, should have access to affordable, high quality early learning and childcare for an average of $10 a day.
Thank you.
Prime Minister, you were asked this morning, but I was hoping for a little more clarity on this. Anyone over the age of 40 in Ontario is now eligible to go to a pharmacy and get the AstraZeneca shot. That's you. Will you do that? And once you're vaccinated, do you plan to attend the G7 in the UK in June, which looks like other leaders are going to attend? Are you going to be there, or are you going to Zoom in?
My intention has been, as I've said many times, to get vaccinated as quickly as my turn comes up. With the news that AstraZeneca is now available for 40 and up in Ontario, my office and I are busy trying to book appointments, and we will be sure to invite everyone along to help encourage others to get vaccinated as quickly as possible. I'm looking forward to that happening, and we'll let you know as soon as we've concretized the plans for that. In regards to the G7 in June, I'm certainly hopeful that we'll be able to attend in person. I know there are continuing to be restrictions and concerns, but as we get closer to June, hopefully it'll become clear that I will be able to attend in person. But we're going to make a final decision when the time comes.
First of all, as I've said for a long time, I look forward to being vaccinated. I've always said that the second my age group is open to vaccination, I will be vaccinated. We are currently in the process of organizing an appointment in a pharmacy to get my first dose. Probably AstraZeneca. I hope AstraZeneca, to encourage everyone to do the same. And when we have more confirmations, we will let you know so that we can convey the message to all Canadians so that they can be vaccinated with the first one that is offered to them as rapidly as possible. Second of all, with regards to the G7, which will happen in the United Kingdom. I hope I will be able to go in person, but of course we will follow public health guidelines here in Canada, and we will do everything that is necessary to make sure that everyone is safe. Louis Bloin, Radio-Canada. Question. Mr. Trudeau, Ms. Freeland, how can you justify imposing a pan-Canadian childcare system when at the same time there is nothing for health transfer for provinces? This is a criticism we've heard since yesterday. Why not go in that direction? Why not take a step in that direction? Because that's what the provinces want. They say that their healthcare systems are in trouble. They can't move forward. So why didn't you go in that direction? Answer. Louis, we have gone in that direction. For months and months now, we have been transferring billions upon billions of dollars to provinces and territories to help their healthcare system. With, in this budget, an extra $4 billion envelope that will be directly invested in the healthcare system with $1 extra billion for vaccinations. We have signed a $19 billion agreement. We have undertaken transfers. We're paying for vaccines. We are supporting provinces for this, to get through this crisis, because we know that the needs are huge right now. These are additional needs to the usual load, which makes the workload very heavy for provinces. And so we are here, and we have stepped up since the beginning of this crisis, and we will continue to support provinces and the Canadian healthcare system as a whole. What I have always said is that in this pandemic, we have learned many things about Canada and about the weak links in our system, and we recognize, yes, that it will take a greater investment and greater transfers from the federal government to provinces with regards to healthcare. And that's why we had such a meeting on the matter in December. What I have always said, however, is that while, yes, we are here to help in the moment with all tools necessary to fight this crisis, we will wait for things to settle down just slightly once we have weathered this pandemic storm, in order to then negotiate what the transfer landscape will look like in the future and for the long term. We are in a very acute situation right now where acute investments are made to allow the economy and Canadians to recover. That is our priority. But I look forwards to continue our partnership with provinces with regards to healthcare investments, and we will increase healthcare transfers in the long term once that we have weathered this pandemic storm.
We have been investing directly billions of dollars in supporting healthcare systems across the country. From the $4 billion recently announced as part of this budget for general transfers to healthcare, to an extra $1 billion for the vaccine rollouts, to a $19 billion agreement last fall that is there to support the provinces, including lots for health systems, to paying for vaccines, to working hand in hand on the rollout. We have been there to support provinces and territories in the extra costs they're facing because of this pandemic on healthcare. We made a promise to have Canadians' backs, and that's exactly what we're doing, including by transferring billions of dollars to the provinces to help with their healthcare systems. At the same time, we recognize the weaknesses and the gaps that have been displayed by this pandemic, particularly in areas like long-term care for seniors, that are going to require all of us to continue to step up. There have been surgeries put off. There have been extra costs on the provinces that we know need more stability going forward. So we have committed that we will increase transfers to the provinces, recurring and long-term. But the decision about how much and how to exactly do that, we have decided needed to wait until we're through the worst of this crisis. We are there to support Canadians through the provinces with massive transfers right now in this crisis on healthcare, and we look forward to discussions about how we can make more investments for the long term, but our priority right now is getting through this pandemic first, and that's exactly what we're going to do.
You can go ahead, man.
Hello, Mr. Trudeau. Mal Hamidi with the Canadian Press. Your government has been blamed for not implementing quarantine rules earlier and allowing variants of concern to flourish in Canada. Why are we still allowing flights from countries with high rates of COVID-19 and variants of concern such as Brazil and India to fly into Canada?
Well, allow me to correct the record a little bit. From the very beginning, from March 2020, over a year ago now, we brought in some of the toughest, most stringent travel restrictions of any of our peer countries around the world. From last March onwards, a mandatory 2-week quarantine has been in place for anyone arriving in Canada. And that is something that has been extremely effective in limiting the importation and therefore the spread of COVID-19. However, as we saw the emergence of variants around the turning of the new year, we increased significantly our restrictions at the borders, demanding, for example, a pre-departure PCR test to demonstrate that the travelers are negative for COVID when they get on the plane to come back to Canada. On top of that, as time rolled on, we added even more measures. It is now mandatory to get a testing on arrival as well. There is quarantine for 2 or 3 days while you wait for that test result in government-approved accommodations for air travelers, and everyone does follow-up tests while they quarantine in with an approved quarantine plan once they arrive. We have been very firm and vigilant on these measures, but of course, as I always say, we are continuing to look at more, and I have asked our officials to look carefully at, for example, what the UK has done very recently on suspending flights from India, what more can and should be done to ensure that we are not getting cases in from overseas. The measures that we have put in place are limiting significantly and severely the importation of travel-related cases, but we will continue to look at the best science and the best measures that we can do to make sure that the borders continue to be a protection against spread of variants and COVID-19 inside of Canada.
Thank you. Next question.
Hi, Prime Minister Trudeau and Deputy Prime Minister Freeland. Thank you for taking our questions today. I wanted to ask you about military sexual misconduct. It was mentioned in the budget. We're now 2.5 months past when the story broke. We still don't have any details about what the probe into this is going to look like or whether the watchdog mentioned in the budget will be reporting to Parliament, but Liberal MPs did shut down the committee that was investigating this. I'm wondering if you're concerned about the message that sends to the victims of sexual misconduct, that there hasn't been action yet, and if you can give us any kind of a timeline or a benchmark for action on this.
The message is very clear. No one should ever face harassment, intimidation, or assault while serving in the military or in any other job across this country. The women and men who stepped up to serve their country deserve better than they have received in terms of protections and support over the past many decades. Over the past 5 years, we have taken significant measures to improve the processes, but it has become very, very clear that they are inadequate, that the culture change has not happened fast enough, that there are not yet the right supports for people who come forward with allegations and heart-wrenching stories of abuse and intimidation. We are taking this extremely seriously. Processes are in place to stand up new measures and new approaches. We recognize that the time is not just for discussion, the time is for action, and that is exactly what we are moving forward on, why the committee independently decided to move forward with moving on its report and getting action going. But as also was mentioned, there are measures in the budget that directly target that, and I will turn to Minister Freeland to further expound on it.
Yeah, thank you for the question, Mercedes. And, just to say, we did put that in the budget because we recognize how urgent the challenge is. It's very important for our government that all Canadians, no matter where they work, need to be safe from and free of sexual assault and sexual harassment. And that is going to be a priority for our government. And, we are putting in place really important measures to make sure that that's the case.
Une dernière question au plancher.
Suivi sur le
A follow-up on Bill 21. There is a court that suspended a number of articles with regards to Anglophone CEGEPs. I would like to have your reaction. Is there an open door to a federal appeal? Answer. A decision has been made today. I have yet to have read the details, but we recognize that there is a legal case underway, and we will continue to closely follow this process. Question inaudible. Answer. We will keep an eye on the process that is underway.
Conférence de presse aujourd'hui.